Hello everyone, myself Prakriti, and in our today's presentation we are going to see briefly about cardiovascular assessment, that is inspection method. So this cardiac examination, otherwise called as a precordial exam, which is usually performed as a part of a physical examination or when a patient presents with chest pain suggestive of cardiovascular pathology. Step 1. Wash your hands. Introduce yourself to the patient and clarify their identity. The second is gather the medical history of a patient. So the cardiovascular history is obtained to identify evidence of organic heart disease or symptoms that suggest the presence or possible presence of cardiovascular abnormalities. So has the patient ever had or been told or she had a heart problem? If so, obtain details regarding the diagnosis, when it was made, how it was diagnosed and what was done about it. Ask a past history of any heart attack. If a patient is a known case of coronary artery disease, valvular diseases, rheumatic fever, or the patient is a diabetic or hypertensive. Next is explain what you would like to do and obtain consent from a patient to continue with your assessment. Step 2. Positioning. The patient should be on the bed with the trunk at 45 degrees and they should be exposed from the waist up. So this is how the position we give for a patient. And begin by observing the patient from the end of the bed. Inspect the neck for any jugular venous distension. If there is a jugular vein distension, the jugular vein will be seen like this on a patient's neck. Next, see for any abnormalities like head wagging, or you should note whether the patient looks comfortable, any shortness of breath he has, and should assess the precordium. So this is the precordium which you should assess for any masses or any scars of a previous surgery. If they have a permanent pacemaker, or assessing for precordial bulge. Examination of a precordium, as I told you in the previous slide, assess for any scars of previous surgery. So this is a scars of a median sternotomy. And you should assess for pectus excavatum and the pectus carinatum. So this pectus excavatum is nothing but where you can see the sternum goes inward to form a depression in the chest. And in case of a pectus carinatum, you can see a chest looking as a bird-like appearance, which we sometimes called it as a pigeon chest or a pigeon breast. Step 3. Inspect the patient hands. Initially note how warm they feel, as this gives an indication of their temperature and also how well perfused they are. So here we have to see for the following manifestations. The first being a splinter hemorrhage. So in this splinter hemorrhage, what we see is a tiny blood clots which are present over the fingers, which indicates a suggestion of a infective endocarditis. You should also look for a tobacco staining. Then osseous nodes and Janeway lesions. These Janeway lesions are rare and tender lesions which are present on the palms and soles. Osseous nodes, these are painful raised lesions found on the hands and the feet. Next, you will be seeing for the cyanosis, which is a bluish discoloration which you can see over the nail bits, and clubbing. So this is the changes in the areas are under and around the fingernails and the toenails, which gives an inverted spoon position. The next is xanthomata. These are nothing but the accumulation of lipids which can be seen over the hands. And these are all suggestive of a infective endocarditis. While looking at the face, check for any malar faces. So this is a plum reddish discoloration over the higher cheeks, which is an indicative of mitral stenosis. Also look for a Frankson, which is a diagonal creases over the earlobe. So this area, and this is the normal ear lobe, how it looks and how it be seen in case of Frankson. Also look in the mouth for any signs of anemia such as glossitis, that is inflammation of the gums. See for the change of color of a tongue in case of cyanosis, and check around the mouth for any angular stomatitis, which is another sign of anemia, which indicates decreased perfusion. Moving up to the face, look in the eye for any signs of jaundice, that is yellowish discoloration, especially in the sclera, which is beneath the upper eyelid. Next again see for anemia in the conjunctiva beneath the lower eyelid, and assess for a corneal arcus and xanthelasma. So this is called corneal arcus, which is also known as a senilis arcus. So it's a deposition of phospholipid and cholesterol in the peripheral cornea of the eyes. Next is the xanthelasma. These are the sharply demarcated yellowish deposits of cholesterol, and these are also found underneath the skin but usually occurs on and around the eyes. Pedal edema, it's accumulation of fluid in the feet and lower legs, and this edema can be seen over the foot and ankle swelling. Oh, this is also one of a cardinal sign of congestive heart failure which we look for. So this was just a brief information about the inspection method of cardiovascular assessment. So in my next presentation, I'll be bringing you the other cardinal technique too, that is palpation. Thank you.